and I'm delighted to introduce our next speaker, Hugh, who is Director of Change for Children's Service at Barnardo's. Hugh leads the redesign of services to ensure children and families get the best possible support. Hugh, over to you. No pressure. Yeah, you got to follow up on my solo.
What an amazing introduction. Thank you so much for inviting me. Before I go to the main talk, just a brief moment about Barnardo's. At Barnardo's, our purpose is really clear. We're about changing childhoods and changing lives so that children, young people and families are safe, happy, healthy and hopeful. Last year, we provided essential support to over 356,000 children, young people, parents and carers through 760 services and partnerships across the UK. And we've been around for 150 years. We've been here for children, young people and families who need us most, bringing love, care and hope into their lives and giving them a place where they feel they belong. I just wanted to start with that, just to give us some kind of context. Could I have the first slide, please? Thank you. Children and young people are facing a health and well-being crisis that is multifaceted and will have a long-term negative impact on their healthy life expectancy, their education, attendance and attainment, and their opportunities. These challenges include deteriorating physical health and increasing prevalence of obesity, type 2 diabetes and tooth decay. UK ranks 30th out of 49 of the OECD countries for infant mortality. 1 in 5 children and young people have a suspected mental health condition. Children experience inequalities in prevalence of poor health and in their outcomes. The Darcy Review identified gaps in service provision for children, longer waits for support, increase in hospital admissions, and a disproportionate lack of funding to support children and young people's health. The review found that only 5% of funding was allocated to children, who make up 20% of the population. The needs of children and young people are all too often ignored in service design and delivery, resulting in a lack of accessibility and poor outcomes. Next slide, please. In its 2024 election manifesto, the Labour Party pledged to raise the healthiest generation of children in our history and to halve the gap in healthy life expectancy between the richest and poorest regions in England. Both goals are extremely ambitious and demonstrate the importance of action on child health for this government. Direction and commitments towards these goals have been set out in Fit for the Future 10-year health plan for England, which details the steps the government will take to improve health, well-being and the performance of the health services by shifting care from hospitals to communities, moving from an analogue to digital service, supporting the NHS to prevent poor health rather than just treat sickness. Measures for children and young people in the plan include an aim to improve access to NHS dentistry, promote the uptake of childhood vaccinations, and establish neighbourhood-based health services. The plan also utilises wider reforms to commissioning, resourcing, and acknowledgement of the role of wider government, business, and the voluntary sector in supporting good health and well-being. At Barnardo's, we welcome the commitments within the 10-year plan and the focus on children and young people's health within it. However, these measures alone will not be enough to meet the government's ambitions. The plan must align with wider cross-government strategies affecting the health and well-being of children and young people. In addition, there is currently a lack of detail on the implementation of the plan's fail to act on some of the challenges identified by the Darcy Review, particularly on children and young people's mental health. For example, Barnardo's welcomes the government commitment to expanding mental health support teams, MHSTs, to all schools and colleges. However, MHSTs alone will not solve the crisis in children's mental health. The current delivery model is narrow, only delivering low-intensity cognitive behavioural therapy, and therefore underserves many children, including those with SEND and younger children. Barnardo's recommends that the government expand the MHST model to include a school counsellor within the model, thereby creating MHT+. We also recommend that MHSTs are supplemented by a wider pathway for children's mental health and well-being, including social prescribing, community support, and investment in child and adolescent mental health services. Barnardo would like to see the government provide more detail on its commitments by provision of clear delivery plans and cross-sector alignment, including the Best Starting Life strategy and child poverty strategy, providing a clear vision for what the healthiest ever generation of children mean, with milestones towards achieving this goal and metrics to track progress. Placing children and young people's voices at the heart of the government's three shifts and central to local service design, delivery and evaluation. Filling the gaps into the 10-year plan, particularly for mental health. Ensuring that the changes to financial flows and resources allocation within the 10-year plan support the long-term funding of high-quality services for children, young people and families. Next slide, please. Barnardo's works with children, young people and families across our services and our wider partnership working has given us insight into what works when rewiring the health system to meet the needs of children. Some basic principles are partners within systems feeling empowered to deliver the best service for their populations, taking a data-informed approach to understanding population health and agreeing shared aims and objectives in which all partners understand and are brought into their roles. Bringing in partners who know communities best and can support systems to access their most underserved groups. This includes the VCSE sector and other community organisations and leaders with the confidence of their communities to act as advocates. Once goals are agreed, resources must be shifted to facilitate success and overcome barriers. Any goals at any level should be supported by the right outcome measures that allow progress to be tracked and that measures what is important to those receiving the service, staff and the community. Children and young people must be involved throughout, from identifying local need to service design, delivery and evaluation. Next slide, please. The Children and Young People's Health Equity Collaborative is a partnership between Barnardo's, the UCL Institute of Health Equity and three integrated care systems, ICSs, Birmingham and Solihull, Cheshire and Merseyside and South Yorkshire, to shape the way ICSs create health and address health inequalities among children and young people. Together with our Healthy Equity Champions, which is a group of young people engaged in the project and identifying what health means to them, I think you've heard from one of them today, we have developed the Child Health Equity Framework to underpin action for achieving greater health equity in babies, children and young people's health and well-being. The framework, which sets out the key drivers of health, will be used by our three ICS partners to guide the analysis of data and the development of indicators to assess and monitor health. Inequalities and support the development of interventions to improve the health and well-being of babies, children and people in their local area. More than 300 children and young people across our ICS regions have shared an insight into what health means to them, sharing their lived experience and the factors which influence their lives and well-being. Responses from this work have allowed an understanding of the key views and priorities of children and young people involved. The findings from this engagement have been incorporated into the Child Health Equity Framework to ensure children and young people's views and lived experiences inform and are embedded in it. Next slide, please. The 10-year plan describes neighbourhoods as key to delivering the shifts from acute hospital services to community and as part of the shift towards prevention. The plan commits to the creation of a neighbourhood health service, including development of integrated neighbourhood teams in primary care to bring together a multidisciplinary team of professionals involved in supporting patients in primary care, community and education settings. A neighbourhood health service brings together services in a single setting to support patients and prioritising those with multiple long-term conditions and complex needs, could offer an opportunity to act on prevention and early intervention for children, young people and families, with a priority on the most underserved. Barnardo believes that neighbourhood health care has the potential to truly integrate primary care, education, and community services to promote child health and well-being and provide support in a way that puts the needs of children, young people, and their families first. While we welcome specific guidance for systems in creating neighbourhood health for children and young people, we are concerned that the plans to pilot the further developed neighbourhood health at present do not have a focus on children and young people, and that pilot sites are designed for adults. If we are to truly rewire the health service to work better for children and young people, they should be at the heart of neighbourhood design and not considered a bolt-on or extra. Otherwise, we risk repeating the pattern of designing and delivering service for adults that children should fit into. In addition, leaving systems to design and deliver for children and young people could embed local authorities as better resourced areas for more mature systems. That systems will be able to focus on and deliver for their children and young people, while less developed systems will be without best practice examples and measures of success. Thank you.
Thank you, Hugh. Wonderful to hear all the brilliant stuff Barnardo's is doing. And as we heard earlier, in terms of with reduced funding, despite all that, making a difference, I think that's just absolutely remarkable. Hugh, can I just may I ask one question which has popped up? The 10-year plan is out as you've outlined. Question: were there any surprises from Barnardo's perspective? And what do you think we need to do to really accelerate the change needed from Barnardo's perspective?
I think unfortunately, the surprise from Barnardo's perspective is a lack of the voice of children and young people in that plan. Sorry to say, it's not good, but it's not a surprise either. That's what we're saying. We need to be better at engaging with, as we said before, we need to get better at engaging with children and young people. They need to form part of the plan. For too long, I think they've been seen as a bolt-on. So we have services that are designed and set up, and then children and young people are expected to access that. That's not going to work. It hasn't worked before. It's not going to work now. We need to be better and bolder, and more braver at integrating and accepting and getting children and young people involved and hearing their voice in terms of what we want to do and how we want to do it.
No, brilliant, Hugh. And I think one thing which, in our conversations before as well, it's the emphasis is on children's voices rather than actually more money, which is interesting. It's about how do we make the best use of resources,
Absolutely,
but actually listening to the children first and getting rid of the waste which is already in the system. So I think that's a really, really important point.